Good afternoon, everyone. Bonjour à tous. My name is Erica DiRuggiero, and I'm an associate professor at the Bell Atlantic School of Public Health at the University of Toronto, and I'm delighted to bring to you today a session focused on understanding Canada's approach to intersectoral action in the Sustainable Development Goal era. This program of work involves the participation of a number of members of the research team who are listed here on this slide. And I also want to acknowledge the participation of Olivier Bullion, who is with the SDG unit at Employment and Social Development Canada. And we're delighted that he's accepted our invitation to participate in this session. Next slide. So just to give you an overview of how this session will run, this is one of two dialogues, and there's another one focused on climate change and health, also in the program at the conference. And our session is going to focus specifically on understanding the Government of Canada's efforts to support the 2030 Agenda for Sustainable Development. It will be followed by a presentation from our research team based on results of a literature review and preliminary findings from key informant interviews that we've conducted with federal representatives in Canada about Canada's approach to intersectoral action for the SDGs. And then we'd like to spend a good amount of time to have a facilitated discussion. And so one of the areas that we'd like to further discuss with all of you, in addition to getting your reactions to our presentations and the preliminary findings, is to understand how to proceed with intersectoral action for the SDGs during this period of pandemic recovery. Next slide. So it's my great pleasure to introduce Olivier Bullion. Olivier joined ESDC in June of 2019 to head the SDG unit. And this unit that was created in 2018 was established to provide overall coordination and leadership for the global framework for action for people, the planet, prosperity, peace, and partnership. And so we're really delighted to have Olivier with us. He brings extensive experience working in a number of different roles. And I will turn things over to him, and he will present now the Government of Canada's efforts to support the SDG agenda. Merci, Olivier.
Bonjour à tous. Hi, everyone. As Dr. Ruggiero said, my name is Olivier Bullion. I'm the director of the SDG unit at ESDC. I first would like to thank the University of Toronto and the Center for Global Health for the invitation. And Professor DiRuggiero for hosting this discussion today. I'm very delighted to be here with you today to share of what we've done so far. And during my presentation, I will cover who we are very quickly, what we do, what we've done so far since the ratification in 2015 of the 2030 Agenda, and what we are doing moving forward. Next slide, please. So to go very quickly, some points that you must be, I'm sure, very familiar with. As you know, the 2030 Agenda for Sustainable Development is a call for action to advance sustainable development in the three pillars of sustainable development, so social, economic, and environmental. And the agenda through the 17 SDG covered those three priorities. Unlike its predecessor, the Millennium Development Goals, the MDGs, the SDGs are targeting all countries, developing and developed countries alike. As you recall, the MDGs were mostly targeted at the developing world and could be seen as a development plan to some extent. The SDGs are very different in that sense that they are targeting key issues impacting all of our countries, again, developed and not. What's important is that there is an overarching principle within the SDGs of leaving no one behind. Of course, as part of the 2030 Agenda, countries were invited, strongly recommended to develop their own national strategies, and which is what we've done. Next slide, please. So, of course, the role in the 2030 agenda. It's a shared responsibility that require a whole of government and a whole of society effort. And collaborative partnerships will be fundamental in achieving the 17 goals. But in Canada, just to clarify a bit of who we are and our role, at the federal level, the mandate to implement the 2030 agenda was given to the Minister of ESDC, so Employment Social Development Canada, became the lead to implementing the 2030 agenda within the federal government, but also across the country. In 2018, as Dr. Ruggiero mentioned, the SDG unit was created, and it was decided that it would be hosted within ESDC. It might be a question as to why ESDC as opposed to other departments, such as Environment and Climate Change Canada. I think one of the responses is that a lot of the program on the economic and the social sides are actually administered by ESDC, and as the ESDC, as you will see, is a lead in many of those 17 SDGs. So that might be why it was allocated, or the file was given to ESDC. But so here we are, and so I'm managing a small but mighty team of about 16 people, and our mandate is to lead the overall coordination and implementation of the 2030 agenda. We were mandated to develop a national strategy, to monitor and report on progress, raise awareness, and also develop and administer an SDG funding program. Next slide, please. So since the inception of the unit, we have achieved a few milestones already. I will go very quickly through some of them and develop some a bit more in the following slides. One of the key first achievements was to participate in July political forum, which takes place every July in New York, which is the biggest gathering on the SDG on the international scale, where countries come and share on their experiences with the implementation of the 2030 agenda. And so Canada participated in July 2018 to the voluntary national review. It was a great event in the sense that the delegation that came and present was very representative of all of Canada. We had the Chief Grant Little Child that participated. We had various levels of governments that were participating. So we were really able to show a united face and demonstrate that Canada was addressing the 2030 agenda from a collective point of view. The funding program, it's a 4.6 million funding program that I'll discuss a bit later, was also launched at the end of 2018. And in 2018-2019, we conducted massive outreach throughout Canada. About 50,000 people were reached out to, and based on those consultations, we drafted an interim national strategy that was called Towards Canada's 2030 National Strategy. And that document was again built from recommendation from the public, from key stakeholders, and identify some key actions, 30 actions that would support the implementation of the agenda, as well as some key priorities. So we've kept that in mind when drafting the national strategy that was finally released earlier this year, that I will discuss a bit more. And we've also updated the Canadian indicator framework. So I'll talk about that also in more details in a few minutes. And finally, the federal implementation, that is the federal contribution to the national strategy. Next slide, please. So the national strategy. So as I mentioned, the 2030 agenda, it's a shared responsibility. It's involved everyone, and this is in that spirit that we've drafted the Moving Forward Together, the Canada's national strategy. The objective of that document is to create and foster an enabling environment for ongoing participation, dialogue, and a whole of society collaboration on the 17 SDG. So the document gives broad directions, identify key actions to realize the 2030 agenda, the 30 actions that were mentioned or identified in the towards. It's also, I mean, what's important to understand is that document is highly aspirational in the sense that it's a call for action. It identifies some key priorities for the government to achieve the SDGs, but it's also called for all of sectors of society to come participate in the effort and achieve the SDGs. To complement that high-level document and national strategy, we published in July the Federal Implementation Plan, so which is, again, the contribution of the federal government to advancing the SDGs. Within that document, we've identified and we established lead departments for each of the 17 SDGs, as well as various leads for various cross-cutting objectives, such as leaving no one behind, advancing reconciliation with Indigenous people, and ensuring policy and coherence within Canada's international efforts. These leads identify through mandates, initiatives, program, and level of contribution under each SDG will help support progress on all of the 17 SDGs and the horizontal priorities. This document, the Federal Implementation Plan, also identifies avenues for cooperation between the federal government and stakeholders and partners. It commits, it's one of the important commitments, to report annually to Canadians on progress towards the implementation of the 2030 Agenda and on each of the 17 SDGs. Next slide, please. So when it comes to reporting on Canada's progress, I will spend a bit of time to discuss a bit of the priorities, the ambitions. As I mentioned, the objective of national strategy is to create an enabling environment, and the objective of the Federal Implementation Plan is to discuss and present the federal contribution. But within the national strategy, within the Federal Action Plan or Implementation Plan, there is also the Canadian Indicator Framework. So I'll spend a bit of time explaining this. You must be familiar with the what we call the GIF, the Global Indicator Framework. So when the 2030 Agenda was developed, a number of targets covering the 17 SDGs were identified, and more than 230 indicators were established at that time. That being said, not every country is collecting all the data on those indicators, and some of the targets are global targets, and the baseline is often based on developing countries and not developed countries. So countries were invited to actually refine that framework and develop their own. So that's what we did with the support of all federal departments and StatsCan, Statistics Canada. We've developed our own set of indicators, and that is labeled under the Canadian Indicator Framework, the CIF. So what's important with the CIF is that it identifies Canada's ambitions under each of the 17 SDGs, but also targets and series of indicators that will be used to monitor progress. Those indicators are more aligned with Canada's level of development and ambitions. As you know, some of the indicators in the Global Indicator Frameworks are fairly relevant in the Canadian context. When we talk about some diseases affecting primary school, for example, and those diseases have been eradicated in Canada. This is no longer a goal for us. It's already being achieved. So we work with lead departments to identify what were our new ambitions tailored to the level of development of Canada. And the Canadian Indicator Framework proposes all those indicators and targets for us. So I'll talk a little bit more about health in a few minutes, but it's in that document that we will find what are the actual SDG by SDG ambitions of the federal government. A caveat on that document, to some extent, it's, as I mentioned, the implementation of the 2030 Agenda, it's a shared responsibility. Everybody has a role to play. And the Canadian Indicator Framework focuses on the federal contribution to a large extent to the 17 SDGs. We've identified targets for SDGs that were under the leadership and the authority of the federal government. But for some other SDGs, the main levers are not at the federal level. They are either at the provincial level, sometimes at the municipal level. When we look at SDG 11 on sustainable cities, most of the drivers of action are found at the municipal level. When we look at health, education, a lot of power resides with provinces and territories. So in those cases, there is no fixed target. There are indicators that we're tracking, but there is no fixed targets in the sense that it will require further work with provinces and territories to identify what is Canada's level of ambition under those specific SDGs. Also of importance is when we have identified targets, the target is mostly based on how at the federal level we will try to achieve those targets. We know that PTs, provinces and territories, sometimes have their own strategies when it comes to poverty reduction, for example. And so when our objective is to reduce poverty in Canada by 50% based on the Canadian poverty line, that was developed for that purpose, we know that that decrease of 50% of the amount of people below that poverty line by 2030 relies on federal efforts. But we can achieve better results, greater results, if we were to actually include contribution from other levels of governments and society. So all that to say that the targets that you find in the CIF can be improved and can be reinforced once everybody joined the call for action. That Canadian indicator framework will, of course, becomes the basis for reporting on progress. We will benchmark our results against those indicators, and we will be able to provide to Canadians the status of progress and action implementing in the previous year. But this is only part of the story. It's one part of the story. What we're committing to doing as well is to reach out to our stakeholders, the PTs, the municipalities, Indigenous governments, and various sectors of the Canadian society to include their perspective, their contribution, their experiences with the implementation of the 2030 agenda, so that you can find in Canada's annual report a very comprehensive and holistic view on progress achieved and challenges ahead of us. Next slide, please. So let's talk a little bit more about SDG 3 and what the priorities really are under that. So as you are familiar with, SDG 3 aims to ensure healthy life and promote well-being for all at all ages. It addresses all major health priorities, including reproductive, maternal, and child health, communicable and non-communicable, and environmental diseases. It seeks to implement universal health coverage and foster access for all to safe, effective, quality, and affordable medicine and vaccines. So we have in Canada, we're lucky to have achieved many of those goals and working on improving the others. So for us, the ambition under that goal, it's to foster the adoption of healthy behaviors, and so that Canadians have healthy and satisfying lives. It's also one of the key objectives to seek to prevent causes of premature death. So 13 indicators have been identified to measure where we are. You can find them in the Canadian Indicator Framework that I referred to, but basically you can batch them by indicators tracking healthy lives, healthy lifestyle. So through consumption habits, through populations, the share of the population that might be overweight or obese, through vaccination rates, through incidence of some diseases, mortality rates, et cetera, et cetera. So those indicators will help us benchmark our progress. We're also tracking risky behaviors, so alcohol use, cigarette smoking, vaping for the youth, incidence of the opioid and stimulant overdose as well, to track in relation to the opioid crisis. And it's also complemented by qualitative surveys to measure how Canadians assess their mental and social health. So all those indicators are what we will be tracking and trying to improve, working towards 2030. And to achieve progress, this will be supported by a number of programs. Some of them I'm very sure that you're very familiar with. There is notably the Canada's tobacco strategy, the Canadian drug and substance strategy, There is the healthy eating strategy. There is the Canada Food Guide that is supporting healthy lifestyle. There are a number of initiatives to improve mental health and wellness, including within Indigenous communities. And needless to say, Canada's COVID-19 immunization plan and the response to the COVID-19 crisis. Next slide, please. So how can you contribute? So I've detailed a little bit about what the federal government is committed into doing to implement the 2030 agenda and achieve goals and achieve all ambitions. But we cannot do it alone. And as part of the national strategy, we're inviting you to contribute. So how can you contribute? So of course, you can learn more about the SDG and how you can take actions. So learn about our priorities, familiarize yourself with the indicators that are tracking progress. Decide what are your priorities. I often say nothing comes for free, and the beauty of the 2030 agenda just allows us to actually evaluate and assess trade-offs between the various SDGs. And we can, at times, improve the environment and thinking that at the cost of the economic growth cost, or vice versa, we might want to encourage economic growth, but with negative spillover on the environment. So the idea is not to stop growth. It's to better understand the implication of our actions across those 17 SDGs. Some will have tremendous impact on social, some on environment, some on economic situation of the country and of Canadians. But they will also equally have negative aspects. So the idea is to better understand the pros and the negative impacts of some of our actions, because again, nothing comes for free, and often, I mean, of course, the benefits outweigh the cost, but those costs exist. Pollution exists. Economic growth often leads to pollution. It doesn't mean that we should stop having economic growth. We just have to better understand the implication and how to actually address them. So that's how you can contribute, by identifying the implications, the goods and the bads of your actions, and track your contributions on all of the 17 SDGs, leveraging the Canadian Indicator Framework and the Global Indicator Framework to better understand how you can better track implications of your actions. The second way you can contribute is by joining the dialogue. So we are conducting ongoing engagement on the 2030 agenda. It takes the form of webinars, monthly webinars. We will be issuing a newsletter where we will propose various contributions from various levels of society to share on best practices, share on lessons learned, share on our individual experiences, especially when it comes to the localization of SDGs, how at the local level priorities are established, how at the local level we can track some of the progress on the 17 SDGs. You can participate in Canada's annual report. This is one of the key milestones we will achieve in June this year, and every year moving forward. And we will be reaching out to various stakeholders to seek their contribution to the annual report. There is, of course, the international engagement. So we are spearheading the international effort with our colleague at Global Affairs Canada to improve the 17 goals internationally. But we're also participating in key international events. The most important one that I've already mentioned is the High-Level Political Forum, taking place annually in July in New York, and for which we are every year building a whole of society delegations to accompany the ministers participating to the event. So it's also a way for you to take part in that international action. We will be setting up an external advisory committee to help us guide in the implementation of the 2030 agenda. So we're aiming at doing that next year, and we will be looking for interested parties to participate to the committee. So that's another way to join the dialogue. And last but not least, as I mentioned, we have an SDG funding program. So far, we have financed, we have supported more than 130 projects across the country. many of them with indigenous communities. We've also engaged in a specific engagement protocol agreement with national indigenous organizations, namely the Assembly of First Nations, the Inuit ITK, the Métis National Council, to support them in the implementation of the 2030 agenda, identifying their own priorities, identifying their own targets, supporting the collection of indicators that can support reporting on progress. So again, that's another avenues for participation and implementation of the 2030 agenda. So I'll stop there. Thank you again for having me today, and I'm looking forward to answering your questions.
Merci, Olivier. Thanks so much for that very helpful overview for setting the stage for our discussion. What I'd like to do is perhaps just ask you one question at this point that's come in from the audience, and then I will save the other one for the discussion. So we have a question about, is the SDG document legally binding in Canada? So perhaps you can take that question, Olivier, and then we'll carry on with the presentation.
Do you want me to answer now, or?
Yes, please, yeah.
Sure. Okay, sorry. Yeah, so as I mentioned earlier, it's the national strategy is aspirational because it is non-binding. So every country have committed to achieve the 17 goals, but I also mentioned the benchmark and the level. Truth be told, it's fairly low, especially when we're developed countries like Canada. We have achieved many of the 17 SDGs already because of the level of ambition we are. When we look at poverty again, we are living with more than $1 a day. When we look at the rate of diseases in primary schools, we have eradicated most of those diseases. So to some extent, we have achieved many of the 17 goals, but we wanted to be more ambitious. This is why we have created the Canadian indicator framework, to be more ambitious, to go beyond what the UN. And even though this is not binding at this point, all ministers and their department are accountable for reaching those results. So even though this is not fully, this is not going to be tabled to Parliament, we are not binded by those targets, ministers have made a commitment to achieve those results. So to some extent, we can now say it's binding.
Okay. Thanks. Thanks so much for that response. I thought it would be helpful to sort of do that. So I'm going to now present on the results of our project funded by the Social Science and Humanities Research Council of Canada. So I did want to acknowledge their financial support for this research. And then I will hand it over to my colleague Jocelyn, who will carry through that presentation, and then we'll leave time for an open discussion to be facilitated by Samira Hussein. Next slide. So just to give you a bit of context, so Olivier has already covered the first point, but you know, it really surprises me to what extent, even though 6 years into the SDGs, that there's a need for a reminder, both in terms of how they have really moved beyond a focus on just low and middle income countries as the MDGs had, but that they're really extended to all countries. And that the lens on sustainability is not just an environmental one, but it's really much broader, as Olivier has painted. As you have heard from Olivier, there's great interdependency between the SDGs, and although he shone the light on just SDG 3, one could argue that health intersects with all other 16 in many different ways. And the overarching cross-cutting theme of leaving no one behind really calls out explicitly a focus on equity, which was also one of the gaps that was identified in the MDGs as not paying sufficient attention to both the social determinants of health, to equity, and to human rights. So for our study, what we were really interested in interrogating was intersectoral action. And there are many, many definitions. And our definition really focused on better understanding the alignment of strategies and resources between actors from 2 or more policy sectors to achieve complementary objectives. So as a starting point, that's the definition that we were using. And based on our review, there had been no empirical studies. There are a number of technical reports, voluntary reports, as you've already seen, that had sought to assess how intersectoral action can help to progress the Sustainable Development Goals from the perspectives of federal government actors in Canada. And we saw this as a unique opportunity, in part, not just because of where we sit, but also because the SDGs were explicitly calling on all countries, including high-income countries. And so this presented an opportunity to better understand 6 years in what was happening. Next slide. So in terms of our overview, we aim to understand the collaborative horizontal processes between federal departments working on the SDGs. And we also wanted to know what were some of the enabling and hindering factors that were affecting which SDGs were getting and staying, or we could probably add falling off the agenda. And we'll come back to that partly because of COVID-19 as a great disruptor and how that's affected our country's ability to make progress on the SDGs. The methods that we use is we conducted a narrative literature review of intersectoral action across the public health, global health, and political science and public administration literatures. And we were able to conduct interviews with 17 leaders across 9 federal departments just before the election was called. So we were able to complete those. And the departments that we engaged with through key informant interviews are listed here. So of course, Employment and Social Development Canada, Statistics Canada, given their role in the indicator framework that Olivier just mentioned, Public Health Agency of Canada, because one of the entry points for our work, of course, as a public health school was understanding the role of health, but in its broadest sense, not just health proper, but looking at how health intersects with health, gender, social, and other drivers and inequities. Women and Gender Equality Canada, particularly interested in speaking to individuals there, given Canada's strong commitment and renewed commitment through its feminist agenda. The International Development Research Center, so just outside of government, Global Affairs Canada, Indigenous Relations in Northern Affairs Canada, and Indigenous Service Canada. So this just gives you a sense of the departments with whom we spoke. Next slide. So I'm going to briefly review the findings from our literature review and then speak a little bit about some of our key informant findings and then turn it over to Jocelyn. So we conducted a search of the literature looking at these different concepts. So both intersectoral action, SDGs, public policy and governance theory, given the interest in looking at horizontal processes and thinking about governance as an enabling function to advance policy development. And here are some of the sort of key findings that arose. So this may not be a surprise to anyone who has really interrogated the public health and health promotion literature. But there was a strong trend and sets of origins in terms of the concept of intersectoral action coming from work on the social determinants, healthy public policy, which was very much called out, for example, in the Ottawa Charter for Health Promotion back in 1986. The concept of health in all policies, of course, intersects with notions of intersectoral action. And there have been a number of declarations around calling for greater attention to health in all policies, including, for example, the Adelaide Statement. And we also looked at some of the public administration literature to really better understand what are the mechanisms across government structures that help to facilitate policy development and intersectoral action. The other sort of key finding was that the concept and model development focus was very much focused on trust, really trying to better understand how to reframe away from health to encourage the participation of non-health sectors. This framing as sustainability. Another, I think, concept that some of you may have heard is this notion of health imperialism, where health dominates the agenda, and we have to be incredibly sensitive to how other sectors can be supported and can lead. This notion of committing resources and institutional processes to facilitate intersectoral discussion. There were a number of key areas looking at the importance of clarity and accountability of the role of different actors, and of course, taking advantage of policy windows because policy making is quite incremental. So when those policy windows open, to allow for broader engagement and to build the case for intersectoral action. So next slide, please. And then some of the other findings, and these are further elaborated on, so I'm only focusing in on a few findings, are in a paper that is under review with the International Journal of Public Health. But one of the sort of gaps that we identified in the literature is that power dynamics were under-theorized. And what that meant is that the literature that we included and reviewed did not pay sufficient attention to looking at power relations, power asymmetries in collaboration between sectors. And this is absolutely critical in better understanding what enables intersectoral action. And some of the considerations included the power of governments to redistribute goods, to engineer social and health equity at the expense of other policy priorities, and or using power to maintain the status quo. So very nuanced sort of views of what we mean by power, but a real gap in the literature, which we're trying to redress in our analysis. And also a real need to eliminate power imbalances that of course inevitably unfold in undertaking intersectoral action, and how that might affect the goal of health equity, the leave no behind, and gender equality. So this whole area of power dynamics and the need to further theorize how power comes into play in enabling intersectoral action or hindering it. And then finally, one of the other key areas of finding was that the SDGs do present an opportunity for intersectoral action. Certainly, it's very much implied that while there are 17 goals, really it's the intersections between the goals which will really lead to meaningful change. And so looking at some of the SDGs, for example, the partnerships for the goals, driving partnerships with different countries, encouraging policy coherence and effective partnerships. There are cues in the goals as they are framed that can really help facilitate intersectoral action if enacted. There's also the SDG Partnership Guidebook on how to design and implement intersectoral partnerships. So there's a lot of rhetoric, I would say, and encouragement that intersectoral action is critical to moving forward on the SDGs. And then finally, there is a compendium of national institutional arrangements for the SDGs that are really starting to showcase how countries are governing collaborative processes. So these are just some of the highlights from our literature review, which both included academic and also gray literature to sort of capture how intersectoral action underpinned the SDGs and what was known about the conceptualization of intersectoral action. Next slide. So I will just close with a couple of slides and then turn it over to Jocelyn Trowbridge, who will be in the audience there. So we'll be switching from online speakers to those who in person. And so just in terms of some of the preliminary results from the interviews, so I'll just highlight some of the factors that we identified based on our interviews was what works for intersectoral action on the SDGs. So based on our informants, and I just want to let you know that this is still an analysis in progress, but based on our preliminary findings, we heard from participants in our key informant interviews that facilitative leadership with dedicated resources and skills to bring departments together was absolutely critical. part of that also involves having core leadership skills at executive levels for leading intersectoral action, because it doesn't always come naturally. There are a lot of forces that perpetuate a more vertical approach or a department by department approach. Yet we know that the SDGs require a whole of government approach, as Olivier already signaled, and that requires certain kinds of facilitative leadership skills. Another facilitator was strong historical relationships between departments. So I think that seems quite intuitive, but I think we don't always understand policy context in their historical context, and having a history of collaboration actually provides a really important leverage point upon which further collaboration, for example, on the SDGs can be built. Strong mandate and ministerial direction and primacy of policy area is really, really critical. And so the mandate letters would be an example of that. Some clear articulation of goals, a clear federal mandate, a shared vision and clarity on goals across departments. Another enabler was the clear processes and networks. So really having established interdepartmental working groups that really help to facilitate that horizontal collaboration, clear deliverables, and working groups that move beyond just information sharing to really do joint work planning and working on deliverables across departments. One of the other things that we also learned from our key informants was that there's a symbolic value to the SDGs given where they've come from, and that they were ratified by 193 member countries, including Canada, and some important opportunities to learn from other countries, and the heightened awareness of inequities. The Leave No One Behind slogan certainly emphasizes that, but we've certainly seen a growing attention to inequities due to COVID-19. It's further exacerbated social, economic, racial, and gender inequities. Next slide. So I'm not going to read all of these quotes, but these I think are very illustrative of the things that we heard that were enablers. So for example, we know that legislative mandate or political imperative helps a lot, no matter what. So that's really an important driver. And that there's a growing interest and focus on multi-sectoral approaches and multidisciplinary approaches and expectations to work in this way. And really a commitment to starting to break down some of those silos that otherwise work against intersectoral action, and some of the other facilitating factors related to collaborative workshops and opportunities to co-produce and to co-learn together across departments. So I'll leave it there, and I'll turn things over to Jocelyn, who's been a phenomenal member of our team. And Jocelyn, I think, will be joining hopefully from the audience. I haven't seen her yet, so I'm just going on that assumption. And so she'll take it from there. And she's a PhD candidate in the Social and Behavioral Health Sciences Division at the Dell Atlantis School of Public Health, and also a research fellow at the Global Strategy Lab. And her research focuses on the use of policy theories and mental models in the design of large-scale public health strategies. So I'll turn things over to Jocelyn to walk you through some of our other findings from key informant interviews. And we'll hold the questions, but thanks, keep them coming. We look forward to a rich discussion.
Erica, I am here with Samira on stage and a really beautiful audience in front of us. So for those of you online, I'm very sorry you can't see them all. So I'm going to talk about some of the challenges that we heard from our interview participants. Some of them are intuitive and very expected. For example, the first point, it's a lot of work. Right, working on the individual SDGs that your federal department might have a connection to or a mandate for, as well as integrating all of the cross-cutting themes and looking at how that can be integrated into your work. It takes a lot of time, and it does add to departmental work plans. So that was one of the challenges. Participants also identified the sort of promise of the SDGs as a new lens for this work, but that it could also lead to what somebody termed lens fatigue, which I thought was a really interesting phrase. There's a lens of sustainability. There's a lens of the gender-based analysis plus. There's a lens of reconciliation lens. There's a lens of equality and diversity, social determinants of health, health in all policies. So these are all mental models and approaches to their work. And the SDGs are a very promising way to bring all of that together as a new lens, but it can also lead to a lot of lens fatigue when you're integrating this into your day-to-day work. No surprises that the challenge of the electoral cycles, both on the federal level, there had been about 3, I think, federal elections since the SDGs were signed on to in 2015. And then of course, the different provincial and territorial government elections and the relationships between the provinces and the federal plan. So that is a significant challenge.
Sorry, can I just ask you to say next slide because they're not hearing you, I think.
Sorry.
Yeah, no, that's okay. Slide. Okay, now you're good. Thank you.
Great. Sorry, I thought we had transitioned after you, Erica. Sorry. So for those of you following along, I'm on the 4th bullet, rigid departmental reporting and financial structures. I think there's an opportunity for the SDGs to look at collaboration informally and also formally, and looking at how those formal requirements in reporting and funding these projects can change. We also heard that there are lots of data gaps to be addressed for developing the indicators. I know the Canadian Indicator Framework has made a lot of progress on that, but if the data isn't already collected, then that's a major gap. Resource allocations between the department priorities, I think that's pretty intuitive. It's really hard to always allocate different resources. And capacity and skills for intersectoral action. This was a point participants made about the different ways of thinking for working with the SDGs, the idea that you have to learn different skills around collaboration and negotiation, but also that you have to take on a capacity to learn about a different type of sector that you may not have had your expertise in, and that there's a real need for growing the capacity and skills of the public service workforce to continue on an intersectoral action path. Next slide. As with any qualitative research, we have a wealth of incredible data and lots of great quotes. So I just want to call attention to some of the bolded bits. The first quote speaks to the data gaps. They say, you know, we don't have it. It's difficult to implement priorities such as reconciliation or leave no one behind, where the people you are trying to reach out to aren't documented, or they're falling through the data collection because they're vulnerable. So there is that bit of the snake biting its tail of trying to target an action on people that we don't see because we don't have the data. The second quote speaks to, again, that capacity and skills for putting yourself in somebody else's shoes. To me, the core challenge is often, oh, that's not my lane, that's not my stuff. I don't have to be there, that's not my responsibility. So it's actually overcoming that kind of institutional hesitation around stepping into what might not feel like your lane or your core responsibilities. Next slide. 2 more quotes. A participant identified that nobody wants to talk about power, like nobody wants to talk about power, the participant said, as if we were all new or it doesn't really concern us on a daily basis. And that's one of the key barriers for intersectoral work. And the second quote on that slide is about the lens fatigue, especially for people that have not necessarily seen themselves already reflected in that work. And the participants spoke a bit about how they might be already overwhelmed trying to get up to speed with something they're working on, and now they're being asked to take on the Sustainable Development Goals lens to their work. So there's a lot of getting up to speed to do. Next slide. Finally, I'm just going to speak quickly about how our participants viewed COVID as a disruptor to the SDG work. They found that there were positives to the disruption, that there is a greater appreciation for systems thinking, interdependence, and collaboration, and a very heightened awareness of inequality across Canada and globally. And they thought these were very positive disruptors because they do start to orient people towards some of the stuff we talk about in the goals. But they feared that there was a resource allocation that's going to divert progress on the goals, and that we've already seen some backsliding on progress throughout the last 2 years on some of the goals. Next slide. One of the participants said that what COVID has brought us is this understanding that we have to look at things differently, and then we need to put building back better at the center and look for new ways to build back better. So there's an appetite for quality of life type frameworks, SDG frameworks, things that are multifaceted, that are not just drilling down to one number. The next participant talked about how COVID underscored the need to think about fundamental shifts in the way we structure governance at higher levels. We need understanding of structuring our budgets and processes around this social determinants of type of perspective. And another participant felt that COVID helped recenter the issues, with SDGs being one of the answers. Next slide. And there is still the worry of the swing of resources going into the pandemic itself, and the potential that the progress that we've made on the SDGs that participants said could be stuck. And another participant said, whether voters are willing to vote in a way that's going to continue to pour more money in towards reaching the SDGs, I don't know. I think we're still divided in that case. So to conclude, there was a real sense of promise with the COVID disruption, but also a real sense of worry in how we're going to be allocating our resources going forward. So I'm going to turn it over to my colleague Samira to take us through a few more slides and facilitate a discussion.
Thank you, Jocelyn. I'm going to, yeah, that's what I got it out. Well, as Jocelyn mentioned, COVID has been quite a disruption, and there are opportunities as well as pathways forward for increased cooperation and collaboration horizontally across different departments and agencies in the Government of Canada. We've already seen how many departments and agencies were galvanized in order to respond to the COVID-19 pandemic. It's bring a new realization about how the economy, food security, poverty, leaving no one behind issues, gender and intersectionality played into COVID, and how women in the workplace became a major issue. In terms of housing and homelessness, we saw an immense response in law enforcement, with city bylaw officers getting involved in finding people who are not supposed to be outside. And finally, the environment too was affected. We saw a drop in gas prices, people weren't going to the office. So there was a significant effect there. And so we're seeing now that there is a lot of conversation going on in government, as demonstrated in the key informant interviews that Jocelyn did. However, we also know that none of these are new. We've had pre-existing issues in Canada with homelessness. We've had a housing crisis for many years now. We're not immune to development issues like water and sanitation, as we've been seeing in many of the northern communities in Canada.
Next slide, please.
So finally, with those in mind, what we wanted to do was to have a dialogue and discussion with all of you around what you might have found interesting and new about the preliminary findings and what resonated.
Next slide, please.
So we'll invite you to both, I think Erica, the strategy is that Erica will be doing the questions that are coming in on the platform, and I'll do what the in-person segment of it. Erica, feel free to start because we don't have any questions or comments yet.
So yes, so thanks very much, Jocelyn and Samira and Olivier as well for your intervention. So I did want to maybe start with one of the questions, and then we'll see who would like to take this one. So one of the questions that's come in online is regarding indicators on healthy behavior. So I think this one might be for you, Olivier, because you did speak to this. Fruit and vegetables, this is very much a Southern ambition. How will the inequity of access and food security be reflected in our national report as we move forward? This is a three-part question, so I'm going to pause there and have you respond to this first one if you like.
Sure. So just to summarize, there's a question on data and a question on food security.
Yes, that's
what was
right.
the first part?
So they were the individuals asking around indicators on healthy behaviors, and they were focusing in on fruit and vegetable intake.
Yes.
And how will the inequity of access and food security be reflected in our national report as we move forward?
Yeah, that's an excellent question. So I'll tackle the data one all in once. I think, and that's what Jocelyn, I think, mentioned. It's the big challenge on data. We are bound by the data we have, and one of the key challenge and how to implement the Leave No One Behind is to be able to document what's happening in various segments, and that's the challenge. At times, we are not able to disaggregate data to the sufficient level of details to really be able to monitor progress or absence of progress. This is true for the average population in our cities and everywhere, but it's even more true when we look at indigenous people, where we are suffering from a lack of data that is even more prevalent. And so it's always very difficult to tailor the action when we're unable to disaggregate. So one of the efforts that we're initiating and calling for action among partners is better sharing of data. How do we leverage what is collected by various levels of government, being municipal, provincial, territorial, and federal, so that we can have the best outlook on what's happening. And that leads me to that very good question, fruit and vegetable. This is indeed one of the indicators that is it's a good proxy to measure healthy lifestyles. But to piggyback on what Erica was saying, it's what's very critical about the SDGs is that intersectionality, and that in order to buy fruits and vegetable, you still have to have a certain level of income, and not everybody refuses to eat vegetables or greens. Not everybody is 5 years old. Some people just cannot afford them. So it's one of the challenges. Sometimes the indicators have broader dimensions. The lack of healthy lifestyle, sometimes it's just a personal choice. It's just an eco-social consequences, economic and social consequence. So in order to better document what's going on, we're working, for example, with indigenous people to and communities and governments to better refine what would an appropriate indicator be in their circumstances. And that's a bit of the appropriation of the Canadian indicator framework. How can it be more representative of local realities as opposed to have those very high level aggregate indicators? So that's one of the efforts we all need to invest in. It's just to better be able to disaggregate, but also identify maybe better indicators at time that are more reflective of people's reality on the ground.
Thank you.
Is that addressing all the questions?
No, I think yeah, I think we could probably have a whole session on indicators, but thank you to the individual who asked the question, because I think it's a good example of if we don't take an intersectional lens on an indicator, then we may miss out on the determinants, in this case, of household food insecurity, which have been well documented to be very strongly correlated with income and access. Samira, did you want to take a question from the audience now, or I can keep going with the ones that I have online? And if either of you want to weigh in on any of these questions, please pipe up.
We do have a question from the audience.
Okay, why don't we go to you? We should play a bit of ping pong. We can go back and forth.
Hi, everyone. My name is Michelle Emery. Thank you for the great presentation. I think the findings in particular, to answer that question of what resonated with me, in particular, the specific finding around lens fatigue, it really stood out to me because I think coming from a public health and global health type of perspective, we often talk about these terms, and it came up in the session in the morning around One Health, and thinking about all these different lenses, and then as well, all the different intersectoral or multisectoral ways of working. So HIAP, One Health, Healthy Cities, etc. I'm wondering, with this lens fatigue, what's the best way to move forward? We know that intersectoral and multisectoral policy action is suggested to make leeway on the SDGs, but do you think it's pertinent to actually express that we want to approach, policymaking from an intersectoral perspective? Like, does this need to be reiterated? How do we move to reiterate this and express the rationale and, importance of working in such ways with policymakers? And then how do you suggest to overcome this lens fatigue? Because we do rely on these kind of jargony terms to express what we're thinking, but how do we kind of move past that to actually translate into practice and meaningful and sustained actions? Thank you.
That sounds like a rhetorical question to me. However, I think Olivier, perhaps you might want to respond to that.
Yes, I mean, I can. Don't give me too much space, otherwise I will speak all the session. But no, it's a very good question. I think the lens fatigue is something very real. It's built up from various priorities and of each of our dear leaders. So at the end of the day, we do have a lot of lenses. That being said, there is a bit of a fatigue, but I think there is a bit of a misunderstanding as well. Those are not duplicating lenses. Those are complementary lenses. And the same way we have an environmental lens, and our colleague at Environment Climate Change Canada have developed the Federal Sustainable Development Strategy, which is not to simplify it, but a greening of the federal government. The FSDS, as we call it, focuses on environmental elements under many SDGs. When we look at GBA+, we're looking a bit at the social dimension of the SDGs and that inclusion lens. So I think the challenge is not the multiplication, but how do we integrate those various lenses? And the SDG offers that framework where we can actually identify the three sustainabilities: economic, environmental, and social. And so a lot of work has been done on the environmental front. A lot of work is being done on the inclusion and the social front. The economic sustainability, it's maybe not as developed with the cyclical economy, but the biggest challenge is how do we coordinate those lenses? Is there a hierarchy between the three lenses? Is there an equality between the three lenses, the social, economic, environment? I don't think we've landed somewhere, and even research today is not very clear as to is there one that is more important than the other, and at the end they are all as equally important. I mean, it's great to have a green planet, but if nobody is living in it, it's a bit pointless. We can all be healthy, but without a job. So this is, I think, the challenge is more how do we integrate those three into a framework. But the real challenge, it's, I think, the authorities we all have. We all look at various issues through our silos, through our lenses. And that's the first element we have to break down. All ministers have a mandate letter. If you are the Minister of Environment, you are not the Minister of Industry. So it's how do we make each of us responsible across the board for all of the various elements of the 2030 agenda and stop looking at it through one silo. But again, I think those lenses are actually very useful and they are elements of the bigger answer. So I understand the fear and the concerns at times that there is a duplication of lenses. I think what's missing, it's not that we have too many lenses, it's how do we aggregate them and coordinate better so that we are better at intersectionality.
Thank you.
Samira, maybe I can just add really quickly that I think one of the ways we can harness the expertise is through some of the enablers we heard from our participants, which is how do you co-construct a shared vision, a common vision, the mechanisms, the governance mechanisms that bring people together to create that shared sense of vision that brings those different lenses to the table, because there's a richness to them. and they shouldn't have to compete with one another. Thanks. Sorry, go ahead.
No, thank you. I was going to say that there are these, working in silos often has, each silo has its own lens. However, I think the breadth of the SDGs probably offers an enabling mechanism for each of the silos to find a home and be able to work together from that One Health lens, for instance, as you mentioned, Michelle. So thank you for raising that. Erica, I'll turn to you for any questions you might have on the platform.
Sure. So I'm just going to go back to one comment. So how do we measure intersectional inputs, make sure that individual sectors' actions are complementing each other and are all contributing towards attainment of set targets? And how do we measure duplication, which is, I guess, a different question. Samira or Jocelyn, do either one of you want to take on that question? Just so we can take turns. We'll give Olivier a break.
Sorry, so the question is, how do we measure
intersectional inputs and make sure that individual sectors' actions are complementing each other and are all contributing towards the attainment of set targets?
Well, as a researcher, I'm not doing that measurement or that evaluation, but from what the participants said, there are quite a few mechanisms right now to start measuring what they're doing. I think the process is still new. The federal implementation plan has just come out, but there are reporting templates and there are planning templates. And I do think across or inside departments, there are reporting structures, and there is a new move for reporting structures across departments, is what I'm hearing from the different federal leaders we interviewed who are involved in this work. So I would answer it that way, not necessarily from what I would do, but from what the participants talked about.
Great.
We also have a,
go ahead, Samira.
Erica, we have a question from the audience.
Okay.
Christina, you want to go ahead?
Hi there, Christina Zorowski. I did put a question in the chat, but I need to leave, so I thought I will just ask it in person. What resonated, the messages of what works and what doesn't resonated. The first finding of the literature review resonated. And then what resonated depressingly is we had the Lalonde report, we have the Ottawa Charter, we have this report, we have oodles of these things. I worked in South Africa on HIV. The lessons that were learned painfully through HIV have not been extended to diabetes in the same country. So the question was, very concretely, the SDG agenda and framework, and specifically the monitoring, the CIF, to what extent and how is that very practically connected to other indicators and other strategies, like the net zero strategy, like the climate strategy, like economic and green recovery? Or is this just one more silo, an intersectoral silo, or is there actually some opportunity for transformative change? Or are we at a tipping point?
Sure, I'll probably turn that one over to Olivier to answer, but from what the participants told us, there is a lot of overlap between what they're measuring and reporting on in their departmental requirements and what they're measuring and tracking in the Canadian Integrated Framework. So it looks like there's been significant effort to align those, but I think, Olivier, you're best poised to speak.
No, thanks, Jocelyn. You're absolutely correct. We have initiated a new process to report on the SDG and in progress and tidying that to the Canadian Indicator Framework. So departments are mandated now in their departmental plans, in their departmental report on results, to document their actions and their initiative against the indicator in the Canadian Indicator Framework. But the Canadian Indicator Framework itself was worked with StatScan and all various departments involved in the implementation. And their priorities are the one that you are finding in the CIF. So it's actually what we've done. The CIF is a bit of a collection of all various priorities that are on the top of the agenda right now. And so their indicators you find are the one that a minister will have. So there is a complete alignment between the targets in the CIF and what departments are working towards. What's missing is the various levels of governments, PTs, municipalities that are also strong contributors, but they have their own sets of indicators, and sometimes they are not aligned. So this is the effort moving forward, is to build that mother of all framework to some extent, where we can document the various levels of contribution from the federal to other government at other level, and make sure that there is a complementarity between the sets of indicators we benchmark at the federal level or action against, and what other level of government are doing currently.
Specific to follow, just to make sure that I'm understanding this, and Jocelyn started to answer that. So Stephen Guilbeault's department, does he have a sub unit on the CIF and monitoring for SDGs, or is it the same indicator and the same people who are also monitoring for COP26?
It's the same. So it's the same. Statistics Canada has the mandate, and so all the indicators are aligned. That's the big priority for us.
Sorry to add, just to turn the question back to you. One of our later questions, Christina, was we've obviously with the Lalonde report, the health Ottawa Charter for Health Promotion, the SDGs, green recovery, you name it. There is a very obvious need for action on intersectoral approaches to progress on the SDGs and human development in general. Do you have thoughts on how this can proceed, given the silos, given the desire to move forward on this agenda? And you know, the points you raised, there's the issue of the bureaucracy and the political government working horizontally across, as well as with jurisdictions, as Olivier mentioned. What are your thoughts on how this can proceed?
Thanks. I'm sure everyone has thoughts or comments on this. I mean, I think that a lot of that is coming up in what you're finding. And first of all, we need to recognize the transaction costs. This is a lot of work. It takes a lot of time. And I think we need to be also transparent about the lack of incentives and the power dynamics around that, which may be increasingly happening. I mean, in South Africa, where 80% of TB was HIV, the TB program didn't want to work with the HIV program because HIV had all the money. So why would we work, let them collect the data? However, you also had people who were on board. So I think what we're seeing is an increasing engagement. Those personal linkages are really important. They're not enough though. You need the structural stuff. If you have different key performance indicators for your TB manager than you do for your HIV manager, that's going to be a problem. So I think what you've been finding sounds like there is movement towards understanding that there's the software, the relationships, the dynamics, the shared vision. And there's also the structural things, and you have to look at both, and you have to recognize that it's hard and that there are interests. We can't just say, oh, we all want to save the world, because, maybe we do eventually, but not right now. I want to get reelected, or I want to get, the star on my thing. So
thanks. Are there comments or questions from the audience? Or Erica, did you have comments?
Yeah, I've got some online. Do you want me to go next?
Please.
Okay. So as a follow-on question to data collection about leave no one behind, the SDGs pledge also disaggregate data per sex, age, disability. How exactly is Canada collecting data related to disability in relation to the SDG monitoring and evaluation efforts? Olivier, do you have thoughts on that or others?
No, I can. I mean, not to be too technical, but in Canada, often at the federal level, Statistics Canada has the mandate of collection and reporting on data. Various departments have also mandate to collect data that are not as shared due to confidentiality issues, and they can only be shared with specific purposes in mind. But I think it's something we're all working on, that disaggregation of data, applying those various lenses. There might be a lens fatigue when it comes to environment and other lenses, but the one that we are, I think, where we should focus a bit more, we are already investing more time and energy and resources, but maybe not enough. It's on disaggregation by type of population, people suffering from disabilities. racialized Canadians, women and girls. Those are very critical elements under each of the 17 SDGs, and sometimes it's very difficult, if not impossible, to have disaggregated data for a number of reasons. So a lot of effort is being done. Accessibility is an end as well, so people have to document and try to benchmark progress against some indicators, but it's a work in progress. I have to be honest here, and it is complicated, and sometimes we're we're facing confidentiality issues when it comes to too much disaggregation of the data, of course. So we have to pick and choose the level of disaggregation. It cannot be by sex, by race, by province, by city, by language. Otherwise, you're going to have one data point for each of those indicators, and that's it. So effort is being made, but I think it's a work in progress.
Thanks for that. Samira, do you want to take a question from in the room?
We do have one coming up. Just a second.
Hi, my name's Jan Hatcher-Roberts. So I'm interested in the mechanisms of the coordination. I know long time ago in a land far away, I used to work in the federal government and do interdepartmental stuff. And so have you created an interdepartmental, is there an interdepartmental working group and then sub-goal interdepartmental working groups? And then from that, you're calling data that may not be part of the bigger picture like Stats Canada, labor force survey data, but some of those sub-interests that maybe are one-off every 4 or 5 years collecting data and the data harmonization. Is that how it's working? Or because I wasn't quite clear on that whole piece. Thanks.
Yeah, I mean, thanks, Jen. It's a very good question. There is a governance structure, of course, for the SDG. It's done at the assistant deputy minister level. We have SDG ADM, as we call them, committee meeting on a monthly basis. It's made up of 20 departments, the key contributors and leads, and central agencies and StatsCAD. So a lot of coordination take place through that coordination body. We also have the same at the director general level, and then we have working groups. The idea is to have the leads department. So for each of the 17 SDGs, a department has been identified as the lead, and they are animating policy coherence, discussion, exchange of best practices, alignment of priorities within those groups. So it's a top-down approach. It's led by a group of assistant deputy minister, but then it trickles down throughout the organization with roundtables that are pretty broad because of the number of departments involved in the implementation under each of the SDGs. If that answers your question. And of course, StatsCAN is there as the supporting department for collection, and all the data that we're collecting, it's through StatsCAN most of the time, but the buildup of the CIF was done in very strong collaboration between each department and StatsCAN and ourselves, and the SDG unit and the ESDC, so that there is a coherence. One point that I might want to flag too is that we're also working very closely with our colleagues at Finance to make more connection between the SDG framework and the budget, so that those trade-offs, those arbitrage between what do we want to prioritize, what is the negative impact of some policies, and how do we build them back into the machine. So a lot of effort is being made to align budgets and the SDGs, and you might be familiar with the quality of life framework, which is another lens that is applied by your colleagues at Finance, which is also built up on sustainability and ultimately on the well-being of Canadians, is also benchmarking their indicators against the SDGs so that we don't duplicate data. So it's going from federal and departmental leadership to interdepartmental working group, to relationships with Finance to make sure that all of those priorities are embedded into the budget mechanisms as well.
Thank you, Olivier. You can't see the room here, but Jen gave you 2 thumbs up in terms of answering the question thoroughly. So thank you for that. Erica, did you have any questions you want to highlight from the platform?
Sure. So there are a couple of questions that, again, are calling for some more specificity around indicators. So one was around the leadership indicator that, based on this, participants' understanding does not include leadership by civil society. And, is that actually going to be measured? Any thoughts on that? I think, given, Olivier, what you said in your presentation about what's being captured at the federal level, but also where the levers are at the provincial and territorial level, and now we're talking about government actions, but many actions don't occur in a vacuum and are very much pushed by civil society. And how do we capture civil society engagement and their leadership in advancing the SDGs?
So I'll take that one too. In the annual report, there is two, there will be, not done yet, but there's a two-pronged approach. One is the documentation by SDG, so a bit of that silo-ish view on how are we faring against our targets. But there's also a part on the enabling environment. As I mentioned, the national strategy's objective is to create an enabling environment where everybody can contribute. So we are developing matrices to document the action of various actors. And as part of the drafting process, we are working collaboratively with municipalities, NPTs, and of course, horizontal organization covering major sectors of activities in Canada, so that they can also contribute to the report and include their initiatives, their priorities, so that people have a more comprehensive view of what is being done across the country, not just through a federal lens.
Yeah, thanks for that. And I think it'll be an interesting point of comparison, because I think the history and evolution of civil societies in different countries, highly varies, and also varies by political cycle, depending on who funds civil society. And so I think that will, it's an important set of inputs to capture as part of mobilization, because we know from having reviewed public health achievements from the last century, just to take that literature for a moment, what produced social change wasn't just evidence, it was actually mobilization of civil society to advocate for meaningful change in policy and institutional change. So I think that's an important indicator to capture as we go, as opposed to retrospectively looking at their involvement. Samira, can I turn things back to you if there's any question in the audience?
Can I just add one point, sorry?
Yeah.
Just to piggyback on your answer, I think there's another element that has to be taken into consideration here. I've mentioned at the high-level political forum in New York in July, there is an opportunity for countries to come together and deliver what is called a voluntary national review, VNR. But at the same time, there are VLR, voluntary local reviews, that are presented by various segments of society in various countries. And this is an opportunity for groups that are more dynamic to come and present on what they do themselves. And looking at past VLRs, you realize that even in Canada, there's a lot of, it's bubbling up. And you have groupings of partners that comes together to identify their own priorities and what we call the localization of SDGs. So it's not all done by the federal government, but to take one example, in Waterloo, University of Waterloo, the City of Waterloo are aligning with various business sectors, with academia, with various partners at the local level to come up with their own sets of priorities and indicators, and are engaging into drafting reports on their progress to be able to share their best practices. So it's a bit of a different pace in terms of implementation across the country. So are very eager, but still missing some traction. Some are very robust, very developed in their approaches and moving forward. And some are more, it's nice to have, but we don't have time or resources. So I think it's a different pace approach across the country. But yeah, it's an interesting dynamic, and there are a lot of bottom-up approaches when it comes to implementing the SDGs and identifying, and I think that's where we have to meet in the middle.
Thank you. And of course, that also raises the question as to whether COVID recovery has, and budget allocations and human resource allocations have disrupted the progress of the SDG agenda in Canada. But we'll put a hold on that. We have one last question from the audience.
Hi, Brianna Wadnick. So you mentioned that the Lit Review found that power dynamics had been under theorized, and I was just wondering if you could speak a little bit to how that finding was supported in the interviews, and maybe just share some examples of kind of what that looked like in the from the interviewee's point of perspective.
I think Jocelyn, we're just parsing through the interviews at the moment and still immersed in them, but Jocelyn is probably best placed to answer that.
Sure, yeah, they are still under analysis, but from what the sense that I've gathered is that there are a set of policy priorities currently with the federal government in Canada. Those align very well to some of the SDG priorities, and there are others that might be lower down on the agenda. And so that's one example of how we're not really talking about the power imbalances of the topics themselves, and how politics and political agendas are powerful forces for elevating some of the SDGs and the work on some of the SDGs. The other point participants brought up was simply in terms of who's at the table in these interdepartmental discussions and whether the table is powerful or not. So they talked about the idea that a lot of tables are just information sharing, but that if you are collaborating on something that has action items and responsibilities to take home and come back, that's a better way to get things done in terms of intersectoral action. So I think those are some ideas that are coming through, but I can't speak to everything yet. Does that help?
Thank you for that question. It leads very well into the next session on power and privilege. Erica, did you want to go into closing remarks? I think we have only a few
I think so. And yeah, thanks, Brianna. Hi. I see there are a few familiar voices there in the audience. Thanks for asking that question. I really fully support what Jocelyn is saying, because I think this is an area we really want to further analyze, given what we heard in the literature about the power asymmetries, which actually exist between sectors a priori, in part because of the resource base that they can command, right, and bring to the table. There are a lot of inequities between the sectors that we're talking about. So this has been a really, really rich discussion. I want to take this opportunity to thank Olivier Bouillon for joining us and for setting the stage and responding to many of the questions about the SDGs. Special thanks to Jocelyn for all of her work on the research project and conducting the key informant interviews. As we mentioned, we're still in the process of analyzing the results, and to Samira for facilitating this discussion. This two-way discussion, and I guess it worked out quite well. I wasn't quite sure what to expect, you know, having some of us online, some of us in person. And I also just want to acknowledge the other members of our team, Ahmed and Julia Tan, who's listening in, who have been participating in developing this research project. And finally, a special thanks to the Canadian Association for Global Health for giving us this opportunity to partner with you on one of these policy dialogues. So there's another one coming. I believe it's tomorrow morning, and it'll be focused on climate change. And so it's been a real privilege to collaborate with you on this, and to all the participants online and in the room for all of your very thoughtful questions. So thanks so much on behalf of all of us for taking the time to join us.